All right, so we are joined by Dr. Amirah Nelson, Assistant Professor of Counseling at Jackson State University. And we're in the Human Services Career Cluster, and we've got a room full here at Velma Jackson High School. And we're recording this for all of our friends in Madison County Schools, Rosa Scott, Ridgeland High School, Germantown High School, and the Academic Options Center, and also for our YouTube channel. So thank you so much for joining us. This is the second time you've joined us. Last time you joined us, you were in the Rocky Mountains, getting your PhD at Idaho State University in Pocatello, Idaho, but now you're back here in the Jackson area. So before we get into it, before we get into what it is you do and your program, that's an interesting path. So we'd love to hear your path from Jackson State to Idaho State, back to Jackson State, and the HBCU experience against the PWI experience, because that wasn't just a PWI, that was a PWI in a PWA, a predominantly white area. So it was obviously a culture shock, as it would be for anyone that comes from Mississippi. So we'd love to hear about that journey, because it really is extraordinary compared to most people.
Yes. So my name is Dr. Amirah Nelson, as Greg stated, and I am an assistant professor in our Counseling, Rehabilitation, and Psychometric Services Department, housed in the College of Education at the Jackson State University. And so I graduated from Jackson State University in 2011 with my biology pre-medicine degree, and in 2012, my psychology degree. So I was a double major.
Wow.
And so I moved to the East Coast because that's where my family is from. I'm originally from Atlanta, Georgia, College Park area, South Side. And so I ended up being able to use my psychology degree to teach at Head Start. And so I was placed in a classroom where children had a lot of behavioral issues. And essentially a title was created for me, Therapeutic Intake Specialist. And so I was doing like a lot of CBT interventions. So I quickly realized that I was not qualified to be doing the work that was asked of me, and decided I needed to further my education, right? And I knew that having a bachelor's in psychology and biology was just like a stepping stone that I would have to further, like I said, my education. So I applied to Salve Regina University's holistic counseling program. And I do tell people that that program chose me. And so when you enter the counseling profession, you think you're just going to be able to go out there and give advice. And that's not the case at all. It's a lot of introspection and a lot of deep, critical, self-reflective experiences that you have in that program to become a counselor, right? And so as I was sitting in my theories class, I had to choose a theory that kind of aligned with my personhood. And so I chose multiculturalism and feminist theory. And so as I was doing my literature review, I was very despondent to see that the lack of literature of Black women in my search. And so I remember I was sitting in my theories class and I was like, I'm going to write a dissertation on this, right? I was like, I'm going to write a dissertation on like the Black woman experience, whatever that meant to me at that time. And this was in 2016. So my professor, who is now my friend now, Dr. Amanda Miner, she was like, there's a space for you. And I was like, what do you mean? She said, you know, you can do it all. You can counsel, you can do research, you can teach, you can supervise, and you can have, you know, professional leadership and advocacy. And I was looking at her like, really? And so she was like, yeah, because I knew I was going to get my PhD. I just didn't know what it was going to be in, right. Meaning that I knew I didn't want to do like an EDS. I didn't want to do clinical psychology. And so this space allowed me to kind of do all the things I wanted. So she encouraged me to apply to Idaho State University. And I applied, I got accepted. I went there and it was an amazing experience those 3 years. Being able to grow into my counselor, educator identity, right? To teach future counselors. And so I really have come full circle, because as I was applying for jobs, I thought I was going to end up at a PWI, and that is the case. More than likely, a lot of us do end up at PWIs. However, Jackson State posted that they were hiring for a counselor educator. And I was like, oh my gosh, how cool will it be if I got to work at my alma mater, the school that I graduated from 10 years ago? And so I applied it and I got the job. And so when I talked to students about my journey, I said, my HBCU made me and made me who I am. However, attending a PWI did polish me in a sense of understanding more of the, you know, policy, procedure, structural organizations.
Yeah, and I think it's important to realize, no matter what order you go in, whether you do PWI undergrad, HBCU grad, or whatever. And that goes for anybody, because I always say that, you know, students should never limit themselves, because historically Black doesn't mean exclusively Black. Especially in grad programs, Jackson State is getting more and more diverse. There's more and more non-Black students in these PhD and master's programs that really are getting a lot out of that. But I thought it was interesting. You told me in Idaho, when you were teaching your class, you were literally meeting white kids that were in their 20s that told you were the first Black person they'd ever met in person.
Yeah.
So that had to be a weird experience coming from the South.
Yes and no. So I've been very privileged in the sense that I've been able to live in different spaces. So like I said, I'm from Georgia. However, I have lived in Mississippi when I was much younger, Louisiana, lived in Rhode Island too as well. And so my family, we did quite a bit of traveling. So it wasn't uncommon for me to hear that being in a small town. So the town is Pocatello, Idaho, very small college town, almost like encapsulated, if you will. So I think for me, I would say the more shocking aspect of being in Pocatello was religious belief. So a lot of my students identify with the Latter-day Saints. So you guys probably know it as Mormon. And so they have very patriarchal and hierarchical belief systems. And so what does that look like with students coming into the counseling program with these social identities?
I had forgotten that. That is a great point. That Idaho does have a very large Mormon population. And obviously in any type of human service, in any type of human service field, that's going to be a big deal, because like you said, it's not just going in there and giving advice. You have to know where the person's coming from. That's where the research comes in. That's where knowing the environment comes in, because that could be causing a behavior. Now, let's talk about what it is counselors do, because I think the media portrays it a certain way. You see the movies, and you know everybody thinks you're just laying on a couch talking about your problems. And yeah, there is a lot of talking involved, but there's a lot of research, and there's a lot of therapy, and there's a lot of like we said, environment and fixing behaviors, no matter what gender or age or race somebody is. So talk a little bit about what counselors do and the training that's involved on an everyday basis for these patients that you see.
So what do counselors do? I would say that we kind of are a jack of all trades, right? However, we're in the business of serving mankind or humankind, right? And so what that means essentially is that we help our clients to become change agents. So we promote this, we promote wellness. So majority of counselors will look at the whole person, not just the symptoms that are prescribed. So for example, when you look at the medical field, and I know they're changing their language as well too, right? You know how somebody has diabetes, they'll say, oh, I'm a diabetic. From a counselor perspective, we'll say, oh, this person has diabetes. They're not a diabetic, because that's not all of their social identities. Yeah. So we do a lot of advocacy too. We empower our clients to change in whatever way that's gonna be beneficial for them.
Yeah, and I never thought about that either, because it even though it is a physical part of their environment, changing the mental environment is, like you said, changing the whole person, and that's where the research comes into play, because a behavior or a symptom could be environment based on how somebody's living.
Yeah, and so we embody certain principles. We have our code of ethics, the American Counseling Association. And so we really come from a very humanistic, humanistic worldview, in a sense of we have unconditional positive regard. We convey feelings of warmth, empathy, things of that nature as we connect with the clients who are coming to us for help.
Yeah, and so if a student was either undergrad or grad coming through your program there at Jackson State, what are some of the career fields that they can move into that are in demand right now?
So obviously, of course, counselor, as you continue to grow and hone your counseling skills, right? You can probably do advocacy. You can do consultant work. You can further your education like I did to become a counselor educator. You can definitely go into like more of the ethics and legal aspect of counseling to make sure that, we have rigorous competencies, I want to say, so rigorous training and competency. So there's it's really unlimited what you can do with a counseling degree. So if you're in high school, you can major in whatever your field is. I know a lot more of the traditional route is more of the liberal arts professions, but so the more traditional route is psychology. And then you go into a master's of counseling, because I don't think there are any undergraduate programs, I could be wrong, that your major is counseling. So I've had students who have majored in art and they decided they wanted to transition to counseling because it is very relevant. You can use an art modality to help invoke change in clients. So major in undergrad, whatever you want to, and then come into counseling.
Yeah, and that's a great point, because we're doing a project right now with Mississippi Department of Human Services, and one thing that they have started, and this is in every state really, is starting the alternative forms of therapy, the art therapy, the music therapy, which again goes back to the holistic approach to the person, because a person may not respond to a certain type of therapy, but they do another. So having a diverse background, and just since you said that, I've been thinking about it, because you have to be familiar with neurological terms. You have to be familiar with dietitian terms. You have to be familiar with how people react in family environments. So it really is a very diverse field that you have to be at least knowledgeable in a lot of areas.
Yeah, you do have to be very diverse. And so I often tell students, even though your degree is terminal, this is a lifelong learning profession. So meaning that you're going to continue to grow and be challenged, and being okay with being challenged. So being comfortable with being uncomfortable, if that makes sense, because the world is evolving around us as we know it. What we know now, we barely knew 5 to 10 years ago.
Yeah, and also with the advances in technology, with psychology. I know when I was in college, they did have and that was a long time ago, but they had the psychology lab. But there's, you have to be able to read data, and you have to be able to look at, you have to be able to adjust to the new technology.
You do, definitely. And as you're speaking of that, I'm thinking of telehealth, right? So when COVID happened, it really changed our world and how we connect with other people. So even right now, I'm able to connect with you via Zoom, even though I'd much rather be in person with you. So thinking about advances in technology and research to advance, the counseling profession.
Yeah. And you hear young people say all the time, I want to work with people. I want to work with people. And but at the end of the day, besides having all that knowledge, you have to be able to speak. One thing, and this is going across the board, this is not just, they always think I'm just talking about them. I'm talking about young people in general. The biggest thing we're hearing from these people in different industries, these kids are really smart, but they can't communicate. They can't carry on a conversation. They won't look at me when I talk to them. And that is vital when you are talking about making a person get over any type of stressors or symptoms they may have in a mental standpoint. So how important is that? I mean, obviously you have all the knowledge, but you have to be able to not only listen, but you have to be able to speak. So how important is that in this field, because you're dealing with people?
Oh, it's essential. It's very crucial. Listening. We actually have a skill that we teach. Is called active listening. So meaning that you are listening not only with your ears, you're listening with your eyes, your body, right? And so very crucial to the therapeutic relationship when you're in client and counselor. And so I do often joke that everybody should take a year in counseling to learn how to communicate and be with somebody, especially, and more importantly, I would say be with yourself. How do you communicate with yourself as well? Eye contact, like you mentioned before, is very important. Being able to know when to intervene and stop. And so we do teach all of those, counseling skills in our programs.
Yeah. And even if you don't want to be a counselor, it's vital. And then, and even being a client of a counselor, if you can't speak on what's really upsetting you or what's really causing these stressors, it's hard for a counselor to help you. So being able to speak to people, not like you're texting, you can't talk like you text. So it's a dying skill, unfortunately. And I just think everybody who sees this really needs to know how important that is. Now, obviously, I always like to talk about, because there just always seems to be and obviously I'm on the outside looking in. I'm very aware of that. But just from my experience that I've had as a teacher, it just seems to be that there is a stigma in the Black community of mental health issues. And obviously we know that nobody is immune to it. It is a very real thing, but it is something that can be worked with and can be fixed. And there are great professionals like you that are here to help people that are experiencing that thing. So talk a little bit about what you've seen as far as seeing that stigma and what we're doing to maybe ease the stigma of that in all minority communities.
So I think when listening to your question, something that I've seen since returning back to Jackson State, right? Listening, right? And support. So how are students feeling supported versus the supports that we are actually giving them? So taking the time to understand the individual needs of one student, because what works for one student may not work for the next student, right? So student A may need more time to complete an assignment, whereas student B needs to be more challenged. And we do run into that issue because we live in a very consumer-based world that's, based on capitalist principles. That's another conversation. And so I think to help mitigate some of those issues is to just listen. And I know that's a really big challenge. But my experience has been that students often don't feel supported. And so if these are Black students not feeling supported in a learning environment, just imagine what their environments look like outside of school in their personal lives. So like you mentioned earlier, listening and, being able to kind of be the one to reach out and say, hey, what's going on? Checking in with students.
Yeah, and especially in an HBCU environment, which was built for the very reason to educate young Black students. It would be awful sad to not be in an environment where they felt like they could be listened to. Now, before I get to some of the questions of the students, and I got some good ones. You talked about how it is a very diverse field. Now, we had a nurse last week that talked about in nursing, even once you become a nurse and you learn a particular area, if you get bored with that, you can move into another area. Is counseling similar to that? So, you have your, you get your master's or whatever, and you get into an area of counseling. It's not really your demographic you want to work with. Could you move into a different type of counseling or a different group of people?
Yeah, so something I often ask students is, okay, what do you want to do with your counseling degree? So general counseling is kind of the foundation, and then you have your specialties. So your specialties will consist of school counseling, marriage and couple family, and rehabilitation, right? Yeah, so I'm thinking about what's underneath K-CRAP. And then you have subspecialties, which are trauma, addictions, career. So in group. And so you can pretty much, like I said, it's a very expensive profession where you can find your niche. So maybe, for example, you want to do group counseling and you want to work with adolescents who are in high school, whose parents are divorced. And so you see how I just kind of like really narrowed that focus down, right? So you're able to work with different populations, kiddos, adolescents, geriatrics, so the older population, adults. You can work in the prisons, you can work in hospitals, inpatients. So you can pretty much do whatever it is that you are passionate about when it comes to the field of counseling.
Yeah, and these jobs are not going away. Especially with the new emphasis nationwide on improving holistic health and mental health, and with the ever-growing problem with substance abuse. I mean, there's always going to be a need for people in these careers that have great training. But I do have some great questions from the students. I want to get to as many of these as possible. And these are all mainly ninth graders. But this is Donovan Smith, and this is a good question. He asked, "What does a typical counseling session look like, and how long do most of them last?"
So, depending on what your agency or community based agency requires, but a typical counseling session is clinically, we say an hour, but that hour is 45 minutes clinically because you have 15 minutes to write up your progress notes. Okay. So 45 minutes you're spending talking to somebody, helping them process whatever it is they came to talk to you about.
Yeah. And again, that's a good point too. This, it's not just a talking part. You got to be able to document things.
Yes.
Especially if, if there's any type of court order that's requiring them to be there, if you're going to be a witness in a trial, that note taking and documentation is vital. Now, I didn't even think about that till you just mentioned it. This is Shania Charleston, and this is another great question. It said, how long did it take you to get comfortable to work with all different types of people?
Oh my gosh. Let's see. How long did it take me? I think there was one point in my counseling program when I realized that you don't control who shows up in your chair, right? And so being comfortable again with being uncomfortable, right? Because you don't know what you're going to be presented with. So I would say I kind of got used to that early on in the profession. And it's still something that I'm working on navigating, if that makes sense, because it's not like, okay, you finally got it. It's just a gradual, it's just a gradual thing that you just continuously work on.
Yeah. And that's weird because a person's problem may be the same, but no solution is going to be the same.
Exactly.
Because the way me and you could have the exact same mental stressors and environmental stressors, but the way we're going to work through it is going to be completely different depending on the person. So that's what those progress notes and talking really is vital. That's interesting. This is Kaylee Luckett. She's one of our cheerleaders here at Velma Jackson. And she asked, do you have any regrets of anything you've done on your career path?
Any regrets? I can't say that I have any regrets, honestly. Yeah, I can't say that I have any regrets about my career path. I'm exactly where I need to be in this moment.
That's awesome. Yeah, and I think it's such a cool path to go from Jackson to the East Coast to Idaho and back to Jackson. There's not a lot of people that can say that, and I think that's really interesting. This is Jemiah Carson, and she asked, in a session, how much of the person is the counselor in control of?
Oh, so we're not in. So how can I put this? We set the temperature for the session, if that makes sense. So meaning that you have to be very present with the person that you're sitting with, right? However, the client is in the driver's seat. We're just a facilitator and a guide to help them get to where they want to be.
That's a great analogy. Now, this is Aiden Owens, and he asked, how has this helped you not only in your career, but how has it made you a better person?
Oh my gosh, I'm a better family member, better friend. I'm a better advocate. I have really come into my own in the sense of something that you mentioned earlier about professionally speaking, right? So counseling has helped me to grow because of that deep critical self-reflection that I've had to engage in, right? So I'm often checking in with myself, like, how am I feeling? What are my thoughts? And so you essentially, and there's some wiggle room, you can't as a client to partake in something that you have not done yet yourself, if that makes sense.
Yeah. Yeah, and especially if you don't know how somebody's going to react to it. So that's a great point. I mean, and I know you aren't prescribing drugs, but it's kind of like you're not going to tell somebody to take a drug that hasn't been tested yet.
Yeah.
Wow. This is London Lights, and she asked, "What is the next thing you want to achieve in your career?"
Oh, next thing I want to achieve. Ooh. I'm not sure what the next thing I want to achieve. I would probably say being a mom. I am a mother, so being a great mom to my daughter. That's one of my greatest. That's one of my greatest achievements, and it's something I'm still working on. Outside of that, professionally, I guess I have something. Write a book. Maybe write a book about my experience. Yeah, I'll say write a book.
Well, I think that'd be a great read because I just love hearing you talk about it. This is Panija Walker. That's another one of our cheerleaders here. And she asked, what are your what are your current experiences like with your target population?
So current experiences with my target population. I don't have a target population, I would say. However, my research is on the Black population, BIPOC communities, um, specifically Black women. So if I'm looking at through that lens, looking at them as my target population, I would say is one of overwhelm. Overwhelmed in a sense of, Black women go through so much. And, just looking at it from a historical lens, we could talk about this all day, right? But my experience has been one of overwhelm and trying to balance that, if that makes sense.
Yeah. And it's like you said, you never know who's going to be in the chair. So you could get into a target population as a counselor, but you're going to have to be able to be prepared for anything.
Yes, exactly.
And whether that you're in the private level, in the clinical level, the state level, even in your case, in the university level, if you want to do a job where something is different every day, that is not boring, this could be a great field to get into, because people are always going to need help, and you're never going to see the same thing twice.
Yeah. And let me clarify, I do love working with Black women. So I just want to be authentic and saying that doesn't negate the experience of feelings of overwhelm. But I do enjoy and love working with Black women.
Yeah. And again, and not only as far as professionals, but as far as being able to find professionals, it's, until recently, there hasn't really been a great number of black female counselors. So that trend changing and being able to be more available for the demographic that you're a part of is a very big deal, and that would be for anyone, no matter what gender or race you are. It's just, it's always, for some people, it's always comforting to be able to speak to someone that fits your demographic in every way.
Mm-hmm.
Now we're almost out of time, and we thank you so much for joining us. You're just always enlightened by your knowledge. It's just mind blowing, all the stuff that I learned when I talk to you. But before we go, I just really want these young people to know that, one, that it's okay to seek. It's okay to seek counseling, but also these careers are great for them to look into, because, like you said, there's a need for not only females but minorities to become counselors to serve this community. So, so before we go, tell us about why it's okay to seek help, and why they are so needed to look into this career.
So it's okay to talk to somebody about the issues that you're struggling with, because that's what people were put here on earth to do. We are a social species. And so being able to communicate with somebody to let you know that you are not alone. You don't have to suffer in isolation. As counselors, majority of counselors, we often use the terminology of we. Like, we will get through this. Not you will get through this. We together will get through this, right? So that's one of the reasons why it's okay to seek help from a professional. And so minorities are needed in this field, because the field of counseling is still a white male dominated field. And so it's been very, like I said, interesting to come back to my school, my HBCU, and impart knowledge and wisdom to students, and as they have taught me as well. So I view knowledge through as co-constructed. It's co-constructed. So there's this bi-directional process, right? And so I will say it helps when somebody can understand your experience from a different vantage point. Doesn't make you an awesome counselor, right? And the reason I'm saying this, because my personal counselor, because I do go to counseling, she's a white woman, and we've grown together. However, it does help when you can have somebody who can better relate to your experience, if that makes sense.
Absolutely. So again, great advice. And again, for anybody that's with me now or watching later, there are great mental health professionals here in the Jackson area that are more than willing to help you. And like you said, it's not a stigma. It is something to become a better person, a better parent, a better child, better professional. And again, over there at Jackson State, doing some great things in y'all's Department of Counseling. And if anybody is interested, definitely find them on the Jackson State website. Email Dr. Nelson here. They'll give you some great information about that program. They're always looking for great students coming out of Madison County schools to come take part in their great program over there, Department of Counseling at Jackson State University. So Dr. Amirah Nelson, Jackson State University Assistant Professor, thank you so much for joining us today.
Thank you. You guys take care.
Talk to you soon.